admin stuff with Zoom and also presenting and recording and all this stuff. So we will see again if I can walk and chew gum at the same time. Okay. All right. So let's go ahead and get started. My name is Amy Harris. I'm the manager of Oregon's Patient-Centered Primary Care Home Program. And today you're joining us for the last webinar in our series in preparation of the 2025 standard. And this particular webinar is around our health equity designation, which is new in 2025. So we're really pleased to be able to just talk with you about that and explain how the designation is going to work. And then, of course, answer any questions that you may have about the designation or really any of the other standards and measures that are in the model that are upcoming. So next slide, please, Rachel. So just a couple logistics. We go through this at the top of every webinar. It's going to be recorded and uploaded, which I already mentioned we've been doing for all of the webinars. If you have any technical challenges, you can also private chat Susan Elmancy, who is a co-host for this meeting, so she can help you out with any Zoom challenges you might have. We really encourage people to turn their cameras on if you feel comfortable. It creates a bit more of a shared learning environment and helps us certainly put faces with names. Also, if your name is not visible, you can actually correct that by clicking on yourself, and there's 3 little dots up in the corner, and you can rename yourself to your actual name and put your pronouns if you feel comfortable doing that in your organization as well. That also helps us if we're answering questions or if you have a question. It just helps us to see who is on the call with us today. And then also, if you have any questions or comments, go ahead and pop those in the chat and we'll answer them at the end of the presentation. You can also unmute yourself at the end and verbally ask your question as well. We're pretty casual on these webinars. So great. So next slide, please. So this is what we're going to cover today. I'm going to briefly talk about how the 2025 standards were developed. We have talked about this in the introductory webinar that we did on the overview, but I'd like to just revisit that a little bit as we talk about the health equity designation. So I'm going to talk just a bit about that. And then also give a really high-level overview of the 2025 model. That'll be quick, since I'm sure most folks on this call are very familiar with the model already. And then we'll dive into the health equity designation, and I'll talk about the different measures that are part of that health equity designation. And then we'll just provide more information and resources for you, talk about how practices can apply for the designation, and then any questions that you might have about it at the end. So, great. Okay. So the PCPCH program was developed by the Oregon legislature in 2009. And these particular standards of recognition have been revised 5 times since 2009. So this is actually the 5th iteration of the standards. The standards were based, or the 2025 standards the revisions were based on input that the PCPCH program received from community listening sessions that we did in 2021 and 22. And we did those listening sessions with community-based organizations and primary care practices across the state. And what we really were trying to understand was what were the barriers that people were facing around accessing primary care. We were kind of in the middle of the pandemic, kind of tail end of the pandemic, and we really wanted to hear from people what were those big challenges with primary care, because we knew that the pandemic had obviously shined a pretty big light on the fact that primary care wasn't working for a lot of people. And so we wanted to just understand more about that and think about how the program could help address some of those needs around access. So after the listening sessions, we convened our voluntary advisory committee, which is a committee of community partners that always helps us when we're revising the standards. It's not always the same group. Sometimes we have some repeat folks who participate all the time, but it's usually new people every time, which is really helpful. And so we had this advisory committee, and we worked with them for almost 9 months, actually, through a series of meetings. And they helped us really develop these standards and the revisions that we'll be implementing in January, as well as the health equity designation. So we really valued that partnership and really valued that work. And we also took lots of additional feedback from other community partners, practices, in particular that weren't able to participate in the standards advisory committee work. So we got lots of additional feedback on the standards as well. So, and then we implemented them, or we worked on implementing them. And so we're kind of at the tail end of that piece. So these standards are really designed to align with OHA's goals of eliminating health inequities by 2030. So that is a really important component of these standards and the revisions that were put in place. And they do that by really helping to support primary care practices to develop their own capacity to address inequities within their patient population. So which is where we realize practices have the most control over. So really helping practices to think about how they can help and address some of those inequities within their own patient population. And that's what the standards are really designed to do overall, in addition to the health equity designation, which we'll talk about as well. So if we can move on to the next slide, great. So this is just a quick overview of how the model is structured. So as you can see, there are 6 core attributes on the house graphic. These core attributes have remained unchanged since the program was first started, and because they really are the central aspects of providing high quality patient-centered care, and so they have remained unchanged. However, in this upcoming model, equitable was added as a foundational attribute, which really means that equity is a foundation of the primary care home. So we put it kind of as the foundation, as you can see in the graphic. And so what this means is that patients have the same access to care and a means to achieve health, regardless of their diverse backgrounds or circumstances. So that's really what equity means when we think about it in the context of our model. So within the model, there are 35 standards, and each standard has up to 3 measures that indicates how a practice is implementing the standards. So nearly every standard and measure in the model has been revised to really help practices identify or address health inequities in their patient population. So when we went through the standards and looked at what to revise with the group that I mentioned, the volunteer advisory group, we really did look at almost every standard. And there really has been changes, even if they're just small changes to the language or sort of what the expectations are. We really did include equity throughout the entire model. And so of those measures, 13 of them are must-pass measures, which means that they're required. So we have 13 must-pass measures in the model. There are also 3 tiers of recognition that a practice can achieve. So tiers 3, 4, and 5, depending on the number of points or measures that they're meeting. And then there's also the new health equity designation, which I've mentioned a couple of times and is the focus of this webinar. So we'll talk about that in more detail. And that said, even with the health equity designation, as I mentioned, all practices recognized under the 2025 standards will be doing something to improve equity for their patients because it's just built into the model. So it really is not possible to be a PCPCH without doing some kind of work in your practice to help address those inequities within your patient population. It's just built into the model throughout. So even if you don't feel like you can achieve the health equity designation or it feels a bit out of reach, and it feels a little more aspirational for you, also just know that you're still doing great equity work just by implementing the standards, because we do have them. We do have those standards. We do have equity components built into the entire model. So know that you're still doing great work, even if the designation might feel a little out of reach too right now at this point. So, okay, so next slide, please. Great. Okay, so here are the requirements for the designation. So again, this really encourages practices to prioritize health equity in their practice, which we know sometimes can be a challenge. I mean, primary care is asked to do so much, but this designation gives really an additional roadmap or an additional guidance on how practices can really prioritize health equity in their practice. And so that's what the designation is intended to do. Practices have to meet 15 of 20 equity-focused measures to qualify for the designation, and I'll go into what those are in just a couple minutes. And the nice thing about this is that a PCPCH of any tier level can achieve this designation. So unlike our 5-star designation, which I think folks are probably familiar with, 5-star was really intended only for the practices that are like knocking it out of the park in every way, like the ones that are the highest performing practices. They're implementing all the standards. That's what 5-star was really intended to be. It was this top tier level. For the health equity designation, it's different in that a practice can be a tier 3 PCPCH, but if they've chosen to really focus on equity in their patient population and thinking about and in their practice and thinking about implementing those standards, they can achieve this designation. So it doesn't require your practice to be, firing on all 5 cylinders and do the health equity designation on top of it. You can be firing on 3 cylinders and still get the health equity designation and still be doing amazing work. So practices will apply for the designation at the same time that they apply or reapply for PCPCH recognition. And so practices will do that through the application system, which I'm sure folks on here are all familiar with. It's where you submit your PCPCH application. So you will apply for the designation through that application portal as well. And then after you've applied, our program staff will actually verify that you're meeting the health equity focused measures before the designation is awarded. And I'll talk a little bit about that process at the end of the presentation about what that means. So, great. Okay, so here are the health equity designation measures. I apologize in advance that this is a little tiny. I tried to make it as big as I could without creating 20 different slides. So we have them on 4. So I'll go through these and just briefly describe them. And also I want to note that the standards that you see over in the left column, if there's the little red asterisk, so you can see there's one next to electronic access, alternative access again. Those are measures that have a full webinar about those specific measures. So, so as part of our webinar series that we've been doing all year, those are ones that have a specific focused webinar that you can watch the recording of. So if you're not sure how to meet that, or you want a little extra information other than what's in the TA guide, we do have full webinars about the ones that have the asterisks next to them, the red asterisks. So the first measure is one I think that's familiar to everyone. It's been in the standards for a long time. It's really providing that like in-person access to care after traditional business hours. And again, the purpose of that measure is really to meet the needs of patients who cannot come into your practice during a normal, 8 to 5 working day because they themselves are working. And so that really is about increasing access for people who cannot get away during the workday to come in. And that's been in the model for a very long time. It actually was a 5-star designation measure as well, because it's something that we've heard from patients that's very important to them to be able to have those additional after hours appointments if possible. Another measure that's a health equity measure is just ensuring that your patients have, access to continuous clinical advice by phone in their primary language. So making sure that they not only can access clinical advice, but also it is in a language or format that is accessible to them and understandable to them. Also, another measure is that the practice would provide an electronic copy of health information to patients in an accessible format to them as well, either that be via language or via if they need something, if they have a disability and they need to have that presented to them in a different format as well. Another one is around providing telehealth services to patients in their primary language. So not just providing telehealth, but making sure, again, that practices or that patients are getting that in their primary language. And then also another is being able to offer one alternative visit type. And by alternative visit type, we mean alternative to an office visit that can demonstrate that it improves access for patients. So, okay, so here are the others. Here's the 2 out of the 4 slides on this. So another one that's around the same standard around access is that the practice provides patient care in community-based settings. And we have in the TA guide as well as in the webinar what we mean by community-based settings. And so I would encourage, if you're interested in attesting to that measure, you should definitely check out the examples that we have in there and see what we mean by community-based settings. Another health equity measure is that the practice tracks and reports to OHA and demonstrates improvement on disparities in 3 primary care quality measures. And we have a lot of details about what that means, the types of measures. It's all listed in the TA guide. I think folks know that you can choose performance measures from various sources now. We don't have our own source in the TA guide any longer. So I would really encourage people to take a look at that measure as well. The next is really around, this is actually an either or. So practices can either attest to either of these measures that fall under patient and family involvement. And this is really around PFACs. So does your practice have an established PFAC or a way to get feedback from patients and their families and caregivers? Or do you have a caregiver advisor, which some practices do? They might have a particular person that really just serves as an advisor and is just even more integrated into the practice than, say, a PFAC might be. And I will note, although we did not do a webinar about this measure this year, last year we had a full learning collaborative about this standard. And so I would really encourage you, if you're interested in learning more about how practices have implemented PFACs and patient advisors, to really go back and watch that learning collaborative. I think there was 3 in the series, 2 or 3 in the series, because we had a lot of great practices come and share their work and how they're doing that. And so it was really, I think, beneficial for the people who are able to attend that. And hopefully, if you want to watch the recording, you'll find it beneficial as well. We also have a measure in the health equity designation around ambulatory care sensitive condition utilization. So basically those utilization measures, where the practice would be identifying your patients that are experiencing disparities in one of the utilization measures, and you basically contact the patient's families or caregivers for a follow-up. And again, we have in the TA guide the different lists of sources where you can find those utilization measures. And then another one that's kind of a key component of providing equity-focused care is screening your patients for health-related social needs, and then also making sure that they have referrals or community-based resources available to them if they're screening positive for those. And we have some different examples of what health-related social needs are in the TA guide. We also talk about which ones you may be tracking for your coordinated care organization, which you can use, but you don't have to use them. You can screen for other things as well. So that's an important piece of this designation as well. So next slide, please. So the next section, so you can see, again, another one around health-related social needs, making sure this one's a bit different. It's not really necessarily providing a referral. It could be providing a referral or offering the intervention directly to patients as well. So this is another important piece of that work. And again, we did a full webinar on this standard. So if you want to go back and see kind of what those differences are and what we're looking for within each one, you can definitely take a look at that. Also, there is a equity-related standard around preventative service reminders. And what this really focuses on is practices looking at their patients that might have disparities in coming in for their preventative services and looking at ways that they could reach out to those patients differently. Also, if you take a look here at 4C2, this is around collecting real D and SOGI information and documenting it in your EHR. So that is one of the health equity designation measures as well. And then also really being able to look at your patient population and stratify them according to health risk, and at least one health-related social need or demographic category. One thing that's interesting about this measure that folks always get a little tripped up about is this measure is really about how you are stratifying your data, which then you will likely use for other purposes. So sometimes folks wonder like, well, I'm stratifying it. Is that enough to meet the measure if I'm stratifying it by these different categories? And the answer is for this particular standard, yes. But often you'll use that information in other areas of your work. So again, we did a webinar on that. So if you want to go back and take a look at that, if you have questions about that one, that's there as well. Also, one of our new measures in the model is also a health equity designation measure, and that is healthcare cost navigation. And this was something that when we were doing our community listening sessions, we heard very loudly and frequently from community partners that the cost of care and really understanding the cost of care and what options were available was really a barrier. And so we put this in here, again, with input from the advisory committee that really sort of gives practices some options on how they can help patients figure out those costs, right? I mean, and of course, you're not going to know all the costs, but you could point them in the direction of their insurance provider. You could tell them costs in your clinic if you know them, cost sharing, things like that. So to just help sort of guide them. And there are lots of different options and suggestions that we have in the TA guide about what you could do to meet that measure to help, again, provide some guidance to your patients about what their costs might be to help eliminate that barrier. So next slide, please. So getting into our sixes, which is the last core attribute, we're getting to the end here. So another important piece is making sure that you're providing written materials to your patients in languages other than English. And then also assuring that the patient communication and materials are at an appropriate health literacy level. This is actually also a new measure in the model. We had never really addressed anything around health literacy before, not directly in a measure. So we did add this. And we have some suggestions and ideas about how to assess your materials for health literacy in the TA guide, as well as in the webinar that we did as well around this standard. Also, another one is to just ensuring that the education resources that the education and the self-management supports that you're providing to your patients are culturally and linguistically appropriate for the patient. So that's something that we, again, have heard in our listening sessions, and also our staff team during site visits have seen sometimes where, what's being given to patients may not be in their language. It might not be culturally appropriate for them. And so just making sure that your patients are getting the materials that are going to best help them. And then we have a measure in the health equity designation around surveys. So you can see that you are not only surveying your patients on kind of the typical domains that we already require, but you're also asking some questions around health equity and really including that in your survey, and then thinking about how you are utilizing that information that you get from patients to improve care. And then lastly, this measure is also a new one in the standard, and it's also part of the health equity designation. And it really highlights that partnership between traditional health workers or traditional health worker services as part of the care team, which is something that we have not until now had a specific measure around, although we had talked about in the past the importance of including traditional health workers in the care team, but it had not been a specific measure. So we were really happy to add that and also feel, of course, it's an important part of a health equity designation as well. So those are the measures. I know that's a lot, even though I didn't go into too much depth on any one particular measure, it does still end up being a lot. So if you have questions about those specific measures, we can answer them at the end perhaps, or you can also go back and look at the TA guide or look at or watch one of the webinars that we had on Reddit. Okay, next slide, please. Great. So how do you apply for the how do you apply for the health equity designation? So as I mentioned before, you apply at the same time that you are applying for your PCPCH recognition, either applying or reapplying. So it's the same application portal. Practices aren't going to be able to apply at any other time outside of this. So I think at least when we initially started with the 5-star designation, some practices were able to submit like a paper application for the 5-star kind of after they'd already submitted their PCPCH application. We didn't get too many of those, but we did have some of those as an option. So we don't have that as an option for the health equity designation. You will be applying at the same time that you apply for your PCPCH recognition. And so after that, after you apply and you say that you're interested, you will get an email from the program that has a list of the required documentation, as well as a link to a different website that you will then upload the documentation to. And this would only be the documentation for the health equity measures that you attested to. So if you attested to 15, there's 15 out of 20, if you attested to 15 health equity measures, then you'll be required to upload and submit documentation for 15 measures, so the 15 health equity measures. And so after you have done that and you have uploaded those documents, the site visit team, our program site visit team, will review the documentation that you submitted and potentially schedule up to a 60-minute interview with your clinical staff. And we would do that as kind of a mini verification process. It's definitely not a full site visit for folks on the call who've had site visits. Not a site visit. It's just simply a verification process that you are meeting the health equity focused measures. So again, just reviewing the documentation for the 15 measures, plus potentially a 60-minute interview, depending on how good your documentation is. The better your documentation, the less likely you'll have to have an interview. But if there's things that we can't determine by documentation alone, then we would do a 60-minute interview with your staff. And so after that is complete, we would just inform you if you got the designation or not. We'd let you know. And there'll be a new health equity designation logo and a certificate that we would send out, all the things that you've come to expect with the 5-star. We would be doing the same thing for the health equity designation. So that is the process. So next slide, please. So a couple of things to keep in mind about this designation. These are just questions that we've had and things that people have already asked us about. So it's really important to note that if you're not awarded the designation after our verification process, that there is no improvement plan. So if you're familiar with our site visit process and you have had measures that have been unverified during the site visit process, we do allow practices have an improvement plan where they work with our team. We give them one-on-one coaching to really help them implement those standards that they've missed or those measures that they've missed during a site visit. This is not a site visit process. This is a verification process of a few measures, of like 15 measures. So there really is no improvement plan because improvement plans are really intended to be for practices who have unverified measures that are must-pass measures, requirements, or unverified measures that have resulted in potentially losing a tier level. So it's an improvement plan to keep your current tier level or keep your recognition if you have an improvement plan that's related to a must-pass measure. So because the health equity designation doesn't fall into either of those categories, there is no improvement plan available for this. So if you apply for the health equity designation and you don't get it, if our team determines that you are not meeting the measures, you can apply again in 6 months. So, and that's the process with our PCPCH application as well. So you can apply again in 6 months. So you can work on those things. I'm sure our team would be willing to give you some high-level feedback on, we would let you know why you didn't get it. And you can work on that and apply again in 6 months. So that's how that process is going to go. There are another thing that's a little bit unique is that if you are applying for the health equity designation, you will actually have 2 different dates to track. You will have your PCPCH recognition date, which is the date that you submit the application. So when you put send on that application, and then you will have your health equity designation award date, which is the date that you submitted all of your documentation for the health equity measures. So you will have sort of 2 different dates. You'll have your PCPCH recognition date and your health equity designation award date. And so that won't really matter too much, except if maybe people are asking you, like, when did you get the health equity designation? Then you would have maybe a different date that you could tell them than when you actually got your PCPCH recognition. Because overall, your health equity designation will still be valid through your next PCPCH application date. So you'll still be reapplying for that at the same time that you apply for PCPCH recognition. It's just the start date may be a little bit different. And I put an example here on the slide, as you can see. So like, for example, on February 10th, you submit your PCPCH application. Then on February 27th, you submit all of your documentation for the health equity measures. So that would be your health equity designation award date. So I hope that makes sense. It's a little tricky, and we can we're working on a 1-page document too that we can submit around this that makes it a little more clear for practices as well. Okay, so next slide, please. Great. So here are some additional resources for you. The first and most important, of course, is the TA guide. So you can see that at the top of the page. That is, I hope you're all familiar with that. It has all of the standards and measures listed and all the documentation required. The second link, the 2025 PCPCH Standards Self-Assessment Tool. This I've really been highlighting a lot recently when I've been speaking about the standards. This is a tool that is an Excel version of the 2025 PCPCH application. So what this does is it has all the same questions as what's in the application, which the application does not go live until January 1st. So what this does is it really gives you an opportunity to figure out where you are right now with either your tier level or the health equity measures. All of the questions, again, that are on the application are in this Excel document. And it will calculate for you what your tier will be. So it could be a very helpful tool for you when you go to fill out your application, because you've already done it on this Excel document. So you kind of know where you're at. It could also be a really helpful tool for you if you maybe aren't at the tier level that you think you would like to be. So if you are, at a tier level that's a bit lower, you could really look through the TA guide and see, well, what are some other measures that I could implement between now and when I'm applying. So it also gives you that, that sort of gauge as well. So I've really been encouraging practices to utilize that tool. We have always had that tool available, but I think whenever we go through a change in the model, practices really like to have that sort of extra support and just sort of knowing what their tier might be. And also knowing the questions, right? The application questions in advance could be helpful. And some of you might not want to. You might not even want to deal with it. Might be too much, which is fine too. Like sometimes you just want to only do the application, which is totally fine. I get that. But for those of you who want a little sneak peek, you can definitely use that tool. Also on here, I have our additional resources. So on our webpage, we have a ton of resources around not only the recorded webinars that I mentioned, but tools and templates and white papers around all different areas of primary care transformation, primary care operations, as well as health equity. So if you've never been to our website before and looked at those resources, it's searchable. I would definitely encourage you to take a look at that if you're looking for some kind of resource on how to do this work better in your practice. You can definitely go there and get some ideas. I also included a link here to OHA's strategic plan. So OHA just released pretty recently, earlier this year, our 2024 to 2027 strategic plan that sets the plan for the agency. And as I mentioned, our program and our standards tie into that strategic plan. So if you want to take a look at that and see where the agency is going overall, I would encourage you to do so. And then I also included in here, I mentioned we did the community listening sessions back in 2021 and 2022. I included that report here as well, because that really details all of the information that we gathered in those listening sessions, who we spoke to, what the common themes were. And so if you really are curious about why we have made these revisions in an even deeper level than what we've talked about, that report is definitely the place to get that information. So if you want to take a look at that, that's linked here as well. And also our program email, always can call us. Okay. So this last slide is just includes a link to where our webinars are all pre-recorded or recorded. So as I mentioned, we've been recording all of these webinars, and we've done 16 of them since April, and they're all recorded and viewable. So you can go to our website and watch any of them. And then also I wanted to let you know that we have 2 upcoming office hours sessions. And one's in January, one's in February, and we'll probably schedule some more. And these are really exactly what they are described as being office hours. We are just going to be on the phone or on Zoom. And you can ask us any questions you want to about the standards, about applying, about the health equity designation, anything that's come up. You can give us feedback if you don't have questions, but you just want to come and give us some feedback. We're happy to do that as well. We won't be presenting any information on these calls. We'll just be there to answer your questions and take your comments and chat about primary care if you want to. Happy to do that too. So those are coming up in January and February. Okay, next slide, please. Great. And that's it. That's just our final slide. So we'll move to the questions. Let's see here. Thank you, Rachel, for driving the slides. Okay. All right. So let me just see. Okay, it doesn't look like there's a lot of questions, which means I probably talked too much, maybe, and covered a lot. Okay, so let's see. It looks like, actually, I don't see any questions. Am I missing any, you guys? Okay. Well, do folks have questions? Does anyone want to unmute themselves, or does anyone want to pop something in the chat? Okay, great. Well, that means that either I did a good job or I confused the heck out of you, and you're mulling it over and thinking about what you might have to ask later on. If questions come up, you have comments, you have anything you want to know from the program, you can reach out to us at any time through our email inbox. Rachel on our team answers those emails and does a great job at either answering the question for you or reaching out to one of us who can answer it. Okay. Well, with that, thank you everyone for coming today. And we really appreciate your time and appreciate your engagement. And I hope everyone has a great weekend. Thanks so much.